Hi, my name is Dr. Jennifer Hake, and I'm the medical director of the OCD program at the Oshai Children's Psychiatry Clinic. I'd like to thank the Liberatores for asking us to tell you a bit about OCD. But before that, I want to chat a little bit about what OCD is not. I think the phrase "I'm OCD" gets thrown around a lot. People use it to describe themselves if they're a little particular, if they don't like things a mess, or if they're perfectionistic. I want to tell you that is not what OCD is. OCD is struggling with feeling contaminated and showering for 3 hours, unable to get out of the bathroom because you don't feel clean enough, or walking up and down the stairs a certain number of times until it feels just right, making you miss the school bus or not able to get out the door to go to work. OCD is a serious anxiety condition that involves two kinds of symptoms: obsessions and compulsions. Obsessions are unwanted thoughts or images a person doesn't want to have and cannot stop that create a tremendous amount of distress for that individual. Compulsions are the things a person does to try to get rid of or neutralize the thoughts and the anxiety. These behaviors become rituals that are associated with relief, but the relief is only temporary. And every time this cycle occurs, it reinforces the brain's belief that compulsions are the only path to reducing the anxiety and the distress. Over time, the compulsions get stronger and add new ones, increasing in number that results in people being held prisoner to their own thoughts and by their own behaviors. OCD creates a disruption to a person's functioning in all aspects of life, including home, school, work, and socially.
People with OCD often struggle to find appropriate care for the complexities of the diagnosis. It's an illness that's often misdiagnosed, and there are few mental health providers trained in providing effective treatments. A few years ago, recognizing how prevalent this problem was for children in our community, some of my colleagues at the Children's Psychiatry Clinic at Oshai Children's Hospital started working to develop a specialty clinic. As debilitating as this condition is, it's also highly treatable, especially when started early in its onset. There are effective medications that help to reduce symptom severity, and one specific type of psychotherapy that is a frontline treatment. It's called exposure response prevention, and it's a specialized form of cognitive behavioral therapy that involves intentionally engaging with one's obsessions while working hard to resist giving into compulsion. Over the course of therapy, this treatment works to retrain the brain to be less reactive in the presence of obsessions. It's an incredibly challenging and time-intensive therapeutic process. Sometimes symptoms get a little bit worse before they get better, but over time, patients work hard to recognize that symptoms can improve with time rather than purely through compulsion. It can provide significant relief from symptoms and work to give people their lives back.
Our team is greatly appreciative of the Zach Liberatore Foundation and the support they have provided to help our OCD program to grow. Through their generosity, we are working to increase program capacity by training new faculty in this evidence-based treatment approach, inviting international experts to present to our clinic new and creative approaches to treating OCD, and allowing us to purchase virtual reality technology so we can provide state-of-the-art exposure treatment consistent with emerging research. Their donations have allowed us to improve our outreach to educate community members who are often the first people to identify OCD symptoms in our youth. Additionally, the foundation is instrumental in helping support families' access to services who may otherwise have financial barriers. This funding has made available extensive collaboration with other established OCD programs to aid us in our own regional programs development and support. We are excited to soon be restarting our intensive outpatient treatment program, which allows us to provide a higher dose of therapy 3 days per week to children and families who are in higher need, with the hope of mitigating a need for residential treatment.
I've had the pleasure of getting to know the Liberatore family and Zach personally over the last couple of years. Zach was in the process of figuring out what he wanted to do after college, but one thing that was clear was that he wanted to do something in a helping profession. He was open about sharing his journey with friends who experienced their own difficulties. Zach found great meaning in being a listening ear and educating those around him. For anyone who didn't know Zach, he was a natural for this role, and he regularly stepped into it for his friends and family. When I look at the support shown to the Liberatore family at his foundation's fundraisers, I can't help but think how meaningful it would be for Zach to see so many people coming together to share his experiences, to raise awareness and support for the betterment of kids who struggle with a condition he knew all too well. Thank you again to the Liberatores for your commitment to creating awareness and change, and thank you to everyone who has generously donated to Zach's foundation. We greatly appreciate it.
As you can see, there has been so much accomplished, but still ways to go, and to say that we are excited about this collaboration with Zach's Foundation is an understatement.